I'm Paul Shalkowskis, Professor of Clinical Psychology and Applied Science. I'm also the Clinical Director of the Maudsley Hospital Centre for Anxiety Disorders and Trauma. Fears make the transition into phobias when people have to accommodate, where they have to build their life around avoiding the things that they're afraid of. And then you're really looking at a phobia. So you know you're phobic if you're starting to change your life to avoid coming into contact with the things that you fear. Phobias quite neatly divide into specific phobias, things like cats, dogs, heights. Phobias are very specific things, and generalised phobias, typically social phobia and agoraphobia. Agoraphobia and social phobia are much more disabling in most cases, although occasionally you will see people with specific phobia who are completely handicapped by that as well. But specific phobias are much easier to live with than the more generalised phobias, because you can't avoid people and you can't avoid going to crowded places under most circumstances. Specific phobias actually typically start between the ages of about 4 and 8, so most of the phobias of snakes, spiders and so on start in children, and it's a really good idea in a controlled way to actually familiarise children with the things they're afraid of, and that way we can actually wipe it out before it becomes a problem in later life. Social phobia and agoraphobia start much later, so social phobia starts at puberty, and then agoraphobia starts usually towards the late teens, early 20s, and it's much less clear what's going on there. With social phobia, it may be to do with a continuation of shyness, so shyness sort of essentially being exaggerated to the point of interfering with a person's life. Agoraphobia is often caused by the occurrence of panic attacks, where the person is afraid of experiencing panic attacks in particular places, so doesn't go to those places. For specific phobias, phobias of particular objects or situations, then the treatment always involves some type of exposure, which is confronting the thing you're afraid of. For spider phobias, snake phobias, small animals and so on, that treatment can be done in the space of 3 hours. Highly successful, almost everybody gets better and stays better pretty much forever. If people have a phobia and there's signs that it's getting worse, which typically happens with things like social phobia and agoraphobia, then it's really important that you seek treatment, usually cognitive behavioural therapy. The really good news about phobias is that they're all treatable. With specific phobias, very brief treatment is going to get pretty much everybody completely cured. With social phobia and agoraphobia, the process is a bit longer, but again, cognitive behavioural treatments are highly effective and nobody really needs to suffer from this problem.